When asked, many family and partner caregivers say that heavy incontinence would tip their decision towards moving a loved one to a nursing home. What makes this such an emotionally difficult turning point? Incontinence can be the last straw in a stressful caregiving situation. Let's talk about the issues that make incontinence so difficult to deal with, and I have some tips on how to cope with these concerns. Resistance. What should you do when your loved one is resistant to using pads or protective underwear? An individual asked to use incontinence products daily may feel that they are no longer capable of taking care of themselves at the most basic level. Their response to you might be one of denial, anger, refusal, or passive inaction. Coping. It is important to talk with your loved one in a calm, understanding, and honest way about how their incontinence is affecting you and your ability to provide the best possible care for them. This can make acceptance easier of the incontinence as well as the incontinence products. If the care receiver lives with a mental or cognitive condition like dementia, learn the best approaches by taking a class or attending a support group where you can learn useful tools for more successful communication. Be tactful. Walking in and saying the house smells may offend the care receiver and cause a defensive response rather than one of cooperation. You might feel a sense of embarrassment, not only for yourself, but also for the care receiver. It's hard to be responsible for caring for someone, like your parent, in this very personal and often invasive way. If you are caring for someone of the opposite sex, it can be awkward having to see, touch, and care for their private areas. If you are caring for a parent of the same sex, it may still feel like you're invading their privacy. And finally, there is compassion for the loss of dignity felt by a loved one who now needs care at this level. Talking it out with supportive family, friends, or professionals can be helpful. Acknowledge your uncomfortable feelings. Hire a home care worker or recruit another family member or friend to provide care when it's too hard for you to do. Caregivers are often not at their best when dealing with incontinence. It might feel like the care receiver allowed an incontinence episode to occur on purpose to punish you. You might find yourself getting angry or impatient, especially if help is needed at an inconvenient time, such as when preparing dinner or sleeping. The cost of incontinence supplies can be a concern in the budget of the caregiver/care receiver. And if the care receiver is not cooperative, it puts even more strain on your relationship with them. Some people may also have physical reactions and discomfort to bodily fluids and odors. Admitting to your discomfort is a good first step. Pretending this is not an issue for you, if it is, only makes matters worse for both you and the care receiver. Know that the care receiver is not trying to make your life harder, they have no control over what is happening. This is difficult for them, also. Seek out help through an in-person or online support groups, from a friend or family member who has had a similar experience, or from a social worker, nurse, occupational therapist, or other health professional. You might find yourself getting angry or resentful for having to deal with this situation. Maybe it's just too hard for you to do. Sometimes it may feel easier to just not clean someone up, but this is neglectful of the care receiver and puts the care receiver at risk for skin breakdown and infections, particularly urinary tract infections. Going out with someone who is incontinent takes some advanced planning. Caregivers and care receivers often become socially isolated because of concerns about dealing with incontinence outside of the home setting. Pre-pack 2 small duffel or shoulder bags with everything you might need, such as incontinence pads, wipes, gloves, change of underwear, and other supplies you require. Be sure to include a couple of plastic bags to stash soiled products. Keep one bag with you and one in the car, just in case. If traveling, look for a family/companion bathroom. I hope this information helps, and I'll see you in the next video.